contradict with anybody. This is to just to give you how to study. That is a very important thing, because most of the time these are the poor recalls, and whenever you preoccupy your mind with an option or an MCQ, the probability is there that when you sit in the exam, so without reading the stem, you quickly goes into that option and you make a mistake. So the purpose is solely that. So coming toward the discussion, so syncope is not recognized feature of A, B and C, so you have to look for all options. Hemophilia, aortic stenosis can cause syncope. Diabetes mellitus, hypoglycemia can cause syncope. So carotid body, coming next, carotid body increases stimulation when, now over here I will quickly goes into the option, that is increase in PCO2, but hypoxia, that is decrease in oxygen, they are more sensitive to hypoxia. The carotid bodies are actually the peripheral chemoreceptors, so they are more sensitive to hypoxia than increase in CO2. But if the hypoxia is not there, then the answer is definitely increase in PCO2, while the central are more sensitive to increase in PCO2. Now they can confuse you by changing the body over here, that is carotid body, by changing carotid body with carotid sinus or stretch receptor, carotid stretch receptors. So that is actually then responsive to change in blood pressure, not the increase or decrease in blood pressure, that is the changing blood pressure or the pulse pressure. This is a young MCQ and that is explained to there in detail. So the carotid body, that is increase in PCO2. So coming next, the most common cause. Now the purpose of the lecture is to make you aware of this thing: the body, the sinus, body, the stretch receptors. Now whenever the carotid body are stimulated, whenever the carotid body is stimulated, there will be increased firing in the afferent nerve or decreased firing. The answer is there will be increased firing in the afferent nerve, increased firing in the afferent nerve. And then what about the efferent nerve? There will be increased firing or decreased firing. Now there are two efferents, sympathetic and parasympathetic. In parasympathetic there will be increased firing, but in sympathetic efferent there will be decreased firing. So we have to make our mind clear regarding this. Now if a person is in shock, there will be increased impulses going from the carotid stretch receptor to the brain or decreased impulses. The answer is decreased impulses. Now they will confuse you. The answer is decreased impulses. So what will happen in the efferent? Sympathetic will be activated or parasympathetic? The answer is sympathetic will be activated. So there will be increased firing in the sympathetic efferent, and there will be decreased firing in the parasympathetic efferent. Coming next, the most common cause of anemia in pregnancy, that is hemodilution. The second most common cause of anemia is iron deficiency anemia. Iron deficiency anemia. So coming next, what is the effect of ESR? What is the effect of pregnancy on ESR? That increases. Why? Because of anemia. Because of anemia in pregnancy. So coming next, most important factor in second stage of labor is there is abdominal muscle contraction. That is the right answer. And the second stage of labor is augmented. Now the word is augmented. That is oxytocin. The actual MCQ is the patient is in second stage of labor and that is prolonged. You give oxytocin. The oxytocin is actually augmenting the abdominal muscle in the second stage of labor to expel the baby. So if the word is augmentin, oxytocin. Now this is my purpose, to make you just aware. Middle rectal artery is a branch of internal iliac artery. Middle rectal artery is a branch of anterior branches of internal iliac artery. Now there is another MCQ, interior branches of internal iliac artery or posterior. This is interior branches. And the rectal artery is also called hemorrhoidal artery. Hemorrhoidal artery. Now they will confuse you in the veins, not in the artery. So we are having three rectal veins: superior rectal vein, middle rectal vein, and inferior rectal vein. The superior rectal vein goes into the portal system. The middle and inferior goes through vena cava system, shunting the portal system. So if they ask which of the following goes to the portal system, the answer is superior rectal vein. And which goes to the venous system, that is middle rectal vein and inferior rectal vein. Middle rectal vein and inferior rectal vein. And when you give rectal suppositories, then that is carried by middle and inferior rectal vein directly into system, and that the liver is bypassed. So that gave you maximum bioavailability after the IV. There is another MCQ, bioavailability. This MCQ is very important. Bioavailability determine the concentration of drug in. Now the answer to this is the oral, because when you take something orally, it goes through the gut and it goes through the liver. So the concentration of drug is determined by the bioavailability. In case of oral, they are not talking about the maximum bioavailability, they are talking about the determination of drug concentration. Determination of drug concentration in the blood. So that is oral. Maximum bioavailability, that is IV. Maximum bioavailability, that is IV. LEMS supply of labia majora, now discussed in detail in my first video, that the labia majora drain into the superficial inguinal lymph nodes, and in the superficial inguinal lymph nodes there are medial group and lateral group. Superficial inguinal lymph node is divided into two, the superior and inferior. Let's suppose this is the thigh of the person. So you are having the inguinal lymph node. So you are having the superficial inguinal lymph nodes over here, and you are having the inferior inguinal, so the superior inguinal lymph node and the inferior inguinal lymph node. Superior and inferior. In the superior there is further division. You are having the medial and the lateral. Now the labia majora drain into medial group of superior group of superficial inguinal lymph nodes. That is the right answer. Next, uterosacral ligament, simple MCQ, attached from the cervix to the sacrum. Open your mind, just pay attention. The greatest blood volume is present, it is venoles, 25%. Then veins, that is 22%. Well, it is very difficult for me to turn this page off and you give you the reference, and the reference for this is actually the Genang book, and there is another book written by Indian author. So venoles 25% and the veins 22%. How much? Coming next. Female in labor for 2 hours minus 2 station occipito anterior position. Confirmed by ultrasonography, a dead hydrocephalus baby. Where will gynecologist insert them? Now you are having occipito anterior position. So the posterior fontanelle comes anteriorly. Simple MCQ. Posterior fontanelle about amoeba. Simple MCQ. It is a unicellular protozoan. It is not bacteria. Protozoan. About hydrated cyst, all are true except, now you have to, CPSP is the game of except Not true. All of the following are present except all of the following are false, except all of the following are true except. So you have to pay attention toward these terms. So in bone, yes, it can involve bone. Option B, larva enters human by, no, it does not enter by penetrating the skin. It can be present in human, in larva, is, this is also right. So the, if there is except mentioned, then the answer is B. Larva enters, it enters through ingestion. Which of the following is a carcinogen? The answer is benzidine. Simple. Women having metastasized carcinoma, you give hormonal therapy, they regress in size due to, now this is apoptosis, programmed cell death. Suprapubic incision is given by surgeon. Artery injured in the superficial fat is the inferior epigastric artery. Inferior epigastric artery. So coming next, duodenal nerve does not supply posterior vaginal fornices. Already discussed in the previous, it is actually hypogastric plexus. Posterior communicating artery connects, it connects ICA, discussed in the previous, with PCA above the oculomotor nerve, above the oculomotor nerve, and it is the branch of internal carotid artery. So it communicates internal carotid artery with the posterior cerebral artery. So coming toward the next page, so a patient is having infection in the pretracheal fascia. Infection will spread to anterior mediastinum, already discussed. So the pretracheal fascia, anterior mediastinum. Least likely cause of 17 to 20 week abortion is, now we are having first trimester abortion and we are having the second trimester abortion. In the first trimester, the most common cause is the chromosomal abnormalities. In the second is cervical incompetency is the most common cause. Cervical incompetency. Cervical os is incompetent. So during second trimester, the chromosomal abnormalities least likely. So I will choose over here fetal cytogenetic abnormality. A pregnant lady, 16 weeks, got injured in an accident and there is a fracture of the pelvis. Now remember the trimester wise, if they are giving you a scenario like this, 16 weeks is a very early pregnancy, and the amniotic fluid at this time is not that much to give you amniotic fluid embolism, although there are cases in the first and second trimester as well, but this is fat embolism. Fat embolism occur in fracture of the long bone in pelvis. Long bones in pelvis. For amniotic fluid embolism, there is a criteria, and that usually occur in the third trimester, and there is association with the DIC. For fat embolism, there are neurological complications, and there are petechiae, skin rash, and there are increase in urinary eosinophils. So you have to pay attention with these. So the answer over here is the C, fat embolism. Regarding hyaline cartilage, collagen and elastic fiber, they both are not visible. It means they both are not present over there. Elastic fiber is present in elastic cartilage. Collagen is present in fibrocartilage. In hyaline cartilage, there are chondrocytes only. So the option B is right over here. How can rubella infection be prevented? Anti-rubella vaccine. Anti-rubella vaccine, that is given in the MMR type. So we can prevent rubella infection by giving anti-rubella vaccine. Characteristic feature of chronic inflammation in hepatitis. Now the answer over here is lymphocyte infiltration is the right answer. Chronic inflammation in hepatitis is lymphocyte infiltration. The fibrosis usually occur in cirrhosis. Fibrosis is the term for cirrhosis, though in chronic inflammation there is lymphocyte infiltration and fibrosis, both going on side by side, but the USMLE supports the lymphocyte infiltration. Insoluble storage form of iron is already discussed in detail. The soluble form is the ferritin, the insoluble form is the hemosiderin. Iron is stored in the tissue in the form of ferritin. When the iron store further increases, the ferritin combines together to form hemosiderin, and when it further increases, the hemosiderin then cause damage. So the physiological storage form is the ferritin. Pathological storage form is without damaging the tissue is hemosiderin. And the third one, that is hemosiderin, or the iron storage form that destroying the tissues, then hemochromatosis. And for hemochromatosis, the abnormality is in increase in hepcidin or decrease in hepcidin. In anemia of chronic, in hemochromatosis, there is increased iron absorption. The hepcidin normally prevents the iron absorption, so there is decrease in hepcidin in hemochromatosis. When there is decrease in hepcidin, there will be more absorption of iron. Hepcidin prevents the iron absorption in the duodenum when the stores are sufficient. So more and more iron is absorbed if the hepcidin is decreased. So coming next, so torch can cause congenital abnormalities except option D is right, that is least likely. Wrong about bupivacaine is black sodium channel, acts on anesthetic, acts on resting cell. No, it acts on the activated cell, not resting cell. B is right. Regarding bupivacaine, which is correct? Now this is the poor recall. 5% means 5 gram by 100 ml. But there is something with that, so you have to clear your mind. I think there was 0.2 ml or 2 ml of bupivacaine contain how much. Then there is you have to simplify this formula. So 5 gram by 100 ml. 5% means 5 gram by 100 ml. But this is, I'm sure about this, this is a poor recall. B is right, C is right. A may be right or wrong, depends upon the scenario, but it is a poor recall, so you have to look for in how much ml they are asking. In 100 ml, 5% mean 5 gram per 100 ml. So if 5 gram by 100 ml, so 5 into 5, 2 that is 0. So in 20 ml there will be 1 gram. In 20 ml there will be 1 gram, and you can then use this accordingly. Coming next, average percentage of thalassemia, that is 5%. The gland having more serous portion is parotid gland. Right answer. Bioavailability is one of the factors that determine the concentration of drug if given. Discussed, that is orally. True about kidney in relation, already discussed in my previous lecture with diagram, that left renal vein is anterior to aorta and left renal artery. Coming next, which are the following associated with severe hypomagnesemia? Answer is hypocalcemia. Now coming toward this thing already discussed in detail, the answer is D. Repeat it again and again, and the calculation is right, and I have given the formula how to calculate this in my previous lecture. Nerve supply of urogenital triangle. Now that is pudendal nerve. If that is not in the option, then the right option is ilioinguinal nerve. ilioinguinal nerve. Now there is another MCQ. Which nerve goes through the inguinal canal partially? The answer is ilioinguinal nerve, because it does not pass through deep inguinal ring. It joins the inguinal canal in the middle. Another MCQ is, which of the following nerve does not pass through deep inguinal ring? Now the answer is ilioinguinal nerve, because it does not pass through deep inguinal ring. Another MCQ is, which of the following is not the true content of inguinal canal? The answer is ilioinguinal nerve, because it does not pass through deep inguinal ring. So these are the MCQ associated with that. Which of the following is associated with ovary? Now attached to uterus by broad ligament. And which portion of broad ligament? That is meso-ovarium. Meso-ovarium. Now over here, ovary is intraperitoneal or extraperitoneal? Intraperitoneal. Fallopian tube is intraperitoneal or extra? The answer is intraperitoneal. Uterus is intra or extra? The answer is extraperitoneal. We must learn these things. Urinary bladder, extraperitoneal. Urinary bladder, extraperitoneal. Rectum, extraperitoneal. Appendix, intraperitoneal. Duodenum, the first part is intraperitoneum, and second, third, fourth, the rest of the parts that are extraperitoneal. Jejunum, intraperitoneal. Ileum, intraperitoneal. Appendix, that is intraperitoneal. Cecum, extraperitoneal, because it does not completely cover it. Ascending colon, extra. Transverse colon, intraperitoneal, it is covered, and there is the mesentery is called mesocolon. Descending colon, extraperitoneal. Sigmoid, intraperitoneal. Sigmoid, intraperitoneal. Stomach, intraperitoneal. Stomach, intraperitoneal. Liver, intraperitoneal. Liver, intraperitoneal. Pancreas, extraperitoneal. Which portion of the pancreas is intraperitoneal? This is another MCQ. The answer is tail. Tail of pancreas is intraperitoneal. Spleen, intraperitoneal. Spleen, intraperitoneal. Aorta, extraperitoneal. Aorta, extraperitoneal. So we must learn these things. Lesser sac has how many layers? Or lesser omentum, 2 layers. Greater omentum has 4 layers. 4 layers, because there is fusion. Function of omentum are a lot, but it is called policeman, because it limits the infection not to spread. So we must know about these things. Coming next, inguinal canal, well superiorly bounded by conjoined tendon, and this is the cpsp key as well. The option A is the wrong option. It does not extend from the anterior superior X spine, it extends from the deep inguinal ring. Not present in infants. It is present in infants, but very small length, because the deep and superficial inguinal ring, they are at the same distance, and when the person grows up, then the inguinal canal lengthens. Inferiorly by deep fascia of the thigh, that is the wrong answer. So the right answer is C. Structure passes through great sciatic foramen is piriformis. Pelvic part of ureter relation. Nerve supply of detrusor muscle is 2 is 3 is 4. Detrusor muscle is 2 is 3 is 4. That is pelvic parasympathetic nerve. Already discussed in my previous lectures regarding the urinary bladder, but I would like to explain one controversy over here. The bladder fullness sensation, fullness, it goes in the dorsal column or the lateral column in the spinal cord. The answer is dorsal column. While the pain from the bladder is carried in lateral spinothalamic tract. Lateral. Fullness, dorsal. Pain, lateral. Pain, lateral. So this is the right answer over here. And there is another MCQ. The itch sensation is carried by, it is not the dorsal, it is the lateral. crude touch, again bilateral. It is fine touch, that is bidorsal. Embryological counterpart of Mullerian tubercle, that is Mullerian tubercle or Mullerian eminence, gave rise to the seminal colliculus, right option. In the last trimester of pregnancy, blood is separated by, now this is very important MCQ. If the question says less than 4 months, if the question says less than 4 months, the blood, how is the blood separated? Now the answer is, let's suppose we are having placenta, and this is suppose the fetal side and this is the maternal side, and we are having placenta. So on the fetal side we are having endothelial cells. I am talking about less than 4 months. On the fetal side we are having endothelial cells. On the mother side we are having cytotrophoblast. We are having cytotrophoblast. I am talking about less than 4 months. So if question asks about less than 4 months, the answer is A, fetal endothelium and cytotrophoblast, because they are separated by this. There is the fetal blood and there is the mother blood, and this is the fetal endothelium. These are the cytotrophoblast, and there are syncytial type of cytotrophoblast. But the main barrier is these two things. After 4 months, the cytotrophoblast, they degenerates. Then the answer is in fetal endothelial and the syncytial trophoblast. So the answer over here is this one, fetal endothelium and syncytial trophoblast. Glucose transport from mother to the fetus is, now focus on these things, glucose and local anesthetic, these are highly repeated. So that is facilitated diffusion, glucose facilitated diffusion, and local anesthetic by passive or simple diffusion. Diffusion is always passive, so simple diffusion for local anesthetic is the right answer. Which of the following is associated with severe diarrhea? Now diarrhea would cause metabolic acidosis with normal anion gap. Metabolic acidosis with normal anion gap. But chronic diarrhea can also cause alkalosis. How? By compensation mechanism. Which of the following is associated with megaloblastic anemia? That is folate deficiency and B12 deficiency. Which of the following is associated with megaloblastic anemia that has neurological manifestation? The answer is B12 deficiency. Out of the B12 and folate deficiency, what is the most common cause of megaloblastic? The answer is folate deficiency. Folate deficiency. If a person is a strict vegetarian, the answer is B12 deficiency. B12 lies in the animal sources. If a person is non-veg, then folate deficiency is the right answer, because folate lies in the animal sources. Cooking destroys which vitamin? Answer is folate. The answer is folate. So most of the time we are using the reheated food, so the females are deficient in the folate, so they should take folate. Uremic nephropathy already discussed in detail. A, normocytic normochromic anemia. The answer is decreased erythropoietin. Women having lack of vegetable diet resulting deficiency, I discussed right now. Vegetable, lack of vegetable, folate, they are giving a clue toward the folate. So the answer is neural tube defects. C, the gastroschisis is not related to deficiency of macronutrients or micronutrients. Prevalence is the number of new plus old cases. The key is right. Visual impulse is associated with, the A option is right. It is retinal. The answer is with A, also known as retinaldehyde. Normochromic anemia is associated with, coming next, CRF discussed. Recurrent neuro is a branch of vagus nerve. Simple. Microscopic diagnosis of TB, that is caseous necrosis. Caseating granuloma or the caseous necrosis, that is the microscopic diagnosis. How to differentiate between active TB or passive TB? Answer is culture. How to differentiate between resistance, whether there is drug resistance or not? The answer is DST, drug sensitivity testing. Local metabolite in skeletal muscle decreases total peripheral resistance and increases blood flow. Now there is another MCQ that is coming to my mind. A person is doing some activity, like for example a person is introducing the nail into the wall through hammer. So what happens in the rest of skeletal muscles? If suppose my hand muscles are active, so there is vasodilation in these muscles, but the rest of muscles there are vasoconstriction. This is very important thing. If one part of my body is active in some activity, so there will be vasodilation in the active muscle. In the passive muscle, that is the rest of the muscle, there will be vasoconstriction. Because if you are doing some activity, there is activation of sympathetic system. So the sympathetic system causes what? Causes vasoconstriction in the rest of the body. But the muscles that are involved in the activity, they produces active metabolite, and there causes vasodilation. So decreased total peripheral resistance and increased blood flow to the active muscle. In the passive muscle, the reverse happens. Increase in total peripheral resistance and decrease in blood flow. Autoregulation in coronary is by local metabolites, CO2, adenosine, these things. At the end of marathon race, there is increased glucagon and low insulin, because if you are doing some activity, what happens? The glucose enters into the skeletal muscle without the use of insulin. So no need of insulin. Insulin goes down. And there is increased glucagon. In sympathetic activation, increases the glucagon. Coming next, a pregnant lady has jaundice. The answer is DGT, already discussed. Smooth endoplasmic reticulum is involved in the detoxification, because there is the rough endoplasmic reticulum in which there are ribosomes attached and they produces protein. Which of the following is associated with medial lemniscus? Now we are having medial lemniscus dorsal column system. So remember this, medial lemniscus dorsal column. By the name it is shown, position, sense and aberration. Option C is the right answer. Well, I may be wrong in many of the MCQ, but if there is any problem, you can ask in the comment section below. The purpose is to give you just an overview how to study smart. Which of the following is associated with posterior fontanelle is larger than anterior fontanelle? Not involved in the intrinsic pathway. 7. That is an extrinsic pathway. How is the intrinsic pathway activated? The answer is contact of the blood with the collagen, or you can say blood trauma. And when there is a tissue trauma, then extrinsic pathway. When there is damage to the tissue releases factor 3, and then that is called tissue factor, and that activates the extrinsic pathway. The intrinsic pathway that is activated by the activation of factor 12. This is one MCQ. In the intrinsic pathway, it is activated when the blood comes in contact with the collagen. This is another MCQ. The intrinsic pathway, it is activated when the blood comes in contact with the non-endothelial surface. This is another MCQ. Which of the following is associated with diabetic nephropathy? The answer is urine albumin, that is called microalbuminuria. 7-year-old child having generalized edema. Now the answer over here is the blood albumin. If that is not, then urine albumin. True about allele. Now the answer B is right. It is not identical part of the gene, and they are present on the same locus. Original MCQ is that is on the same locus or different locus. The answer is they are located on the same locus. Allele or the alternative form of a gene. Like for example, say these are like brothers and sisters. If a couple is having only one son or one daughter, Can you say this one daughter is a brother or sister of whom? So it is just like allele. We are having two allele A and B, like brother and sister. A is the brother of B and B is the brother of A. It is like this. A is allele of B and B is allele of A. So it is not identical part, and they are located in the same locus. Locus means the location of gene and chromosome. Coming next, diagnostic of Plasmodium falciparum. The answer is black water fever, because that is diagnostic for Plasmodium falciparum. The other three things can occur in any type of malaria or any type of disease, but black water fever is for this. Which of the following is associated with regimen that supply the durameter? The headache a person is having is because of this durameter. Another MCQ is dura, pia or arachnoid which have the pain receptors. The answer is durameter. The answer is durameter. Which of the following is associated with a vasomotor tone? The answer is C, spinal shock. Which of the following is associated with C6, that is bicep jerk? C6 and C7. The tricep is bicep C6, tricep C7. Coming next. Apex of the heart already discussed in the detail. 10 cm from the met plane, that is 3 to 4 inches from the met plane, 7 to 10 cm from the met plane. But I have discussed in the detail in my last video, you have to choose the 10 cm if it is there, the maximum thing. 7 to 10. If 7 and 8 both are there, the answer is 8. If 7, 8, 9, the answer is 9. If 7, 8, 9, 10, the answer is 10, because the pathological is when it is more than 10. And if we are taking relation with the met clavicular line, the answer is it is 1 cm median to the met clavicular line. Golgi tendon organ causes relaxation. OCPs causes which of the following? The answer is thromboembolism. Well, there is another MCQ for this. Long-term use of OCP causes what? Long-term use of OCP causes hepatic adenoma. Which of the following is associated with carcinoma? The answer is invasion. Metastasis is for carcinoma. Which of the following is associated with malignant carcinoma? The answer is metastasis. Which of the following is associated with menopause? The answer is decreased estrogen and increased FSH and LH. Decreased estrogen and increased FSH and LH. Option A is the right answer. Option A. Estrogen goes down and the FSH and LH goes up. Coming next. Which of the following is associated with defective necrosis? The answer is brain. Now, the pancreatitis, there is confusion. I will clear over here. There can be fat necrosis, there can be liquefactive necrosis. If the question asks about parenchymal involvement, if the parenchyma is involved, then the answer is liquefactive necrosis. But if the question says saponification of fats, then the answer is fat necrosis. Most common is fat necrosis. Most common is fat necrosis. Liquefactive necrosis occurs only when there is damage to the parenchyma of the pancreas. So both are possible in the pancreas. Which of the following is associated with metaplasia? There is chronic irritation or chronic inflammation. Option C is right. Coming next. Congenital cataract associated with rubella infection, that is called congenital rubella syndrome. In which murmur? The PDA murmur, machinery murmur is associated with PDA, with the rubella infection. Which of the following is associated with angiopathy and neuropathy? Both. Answer is DM, diabetes mellitus. Which of the following is associated with alpha motor neuron and gamma motor neuron? Both lies in the anterior horn cell. Both lies in the anterior horn cell of the spinal cord, and they are manipulated by upper motor neuron. Upper motor neuron. They are manipulated by upper motor neuron. Coming next, the following is associated with calcitonin. The answer is from parafollicular cell of thyroid gland. They are also called the C cells, and they are derived from neural crest cell. So the origin is ectoderm. Visual impulse is associated with dissociation of rhodopsin to retinal. Correct statement regarding dead space is, now this is a little tricky. It is unchanged in triostomy. In tracheostomy, the answer is it is decreased in tracheostomy, because you are decreasing this pathway. Increase in tracheostomy, no. Decrease, wrong. Increase in recombinant position, yes. Increase in a shallow breathing, there is confusion regarding this, but yes, it is an increase in shallow breathing. But if they gave you the dead space increase in deep breathing or shallow breathing, answer is it increases in deep breathing. In deep breathing it increases, and I have shared the reference on my Facebook page, that is Dr. Jangir, fcps part first points with the in clinical points with Dr. Jangir. And they up to respiratory bronchiole, no, it is up to the alveoli. I'm talking about the total dead space. The anatomical dead space is up to terminal bronchiole, terminal. In the physiological dead space from alveolar dead space, they beyond the terminal bronchiole, that is the respiratory bronchiole and the alveoli. So there are two options right, but I would choose the option C, increase in recombinant position, because when the person become in the recombinant position, what happens, there is blood flow to the lower portion, and the upper portion there is decreased blood flow. If there is decreased blood flow in the upper portion, what happens, there is decreased oxygenation, and there is increase in the air that does not participate in the gaseous exchange, so there is increase in dead space. Deficiency of factor 9, the answer is FFPs, and deficiency of factor 8, the answer is factor 8, because FFPs has no factor 8. The factor 8 is deficient in FFPs. But if they ask about von Willebrand disease and the patient is having mild bleeding, the answer is desmopressin. And if there is no response, then the next option is FFPs. But for factor 8 deficiency or hemophilia A, you have to give factor 8. You have to give factor 8. Cryoprecipitate is rich in fibrinogen. This is the source of fibrinogen. Now there is another MCQ. Which are the following diagnoses? DIC, the answer is FDPs, fibrin degradation products. Which are the following determines severity of DIC? The answer is decreased fibrinogen. Because normally when the fibrinogen is going to destroy, the liver produces more, but when a stage reaches that is severe DIC, that there is no more production of fibrinogen, so decreased fibrinogen. There is another MCQ. Blood viscosity is determined by fibrinogen, mainly by fibrinogen. The reference is Genau. So coming next, I think we are left only with the 3 MCQ. Which of the following is associated with counseling to help the people to help themselves regarding basal ganglia? Start movement and stop movement. Initiate the movement and stop movement. Present in female pelvis, that is rectovesical pouch. So this paper is finished. Thank you for watching.